to it.
Great.
Okay. So thank you everybody for coming, and thank you also to our speaker for today. So Dr. Reinier Narvaez came to the US from the Philippines when he was 19 years old. He was a nursing student in Manila, but had always dreamt of becoming a surgeon. In Southern California, he juggled work with pre-medical activities as he began his studies at Cerritos College. There, he was an active participant in Project Hope and CCM, culminating in his community college time with UCLA SMDEP, which is now SHPEP. He transferred to Cal State Long Beach for his BS in biology and chemistry minor, graduated magna cum laude and Phi Beta Kappa, and went on to medical school at UCSF. He's finishing his general surgery residency, at the University of Buffalo, having earned an MPH during his research years while studying transplantation outcomes. Eager to devote his skills and deliver compassionate care to the underserved, he will begin, or now you're in, his trauma surgery surgical critical care fellowship at Harbor-UCLA Medical Center. So thank you again for joining us, and I'll let you take it away.
All right, thank you so much for that. Let's see, can you, let me share my PowerPoint presentation. If you could give me a capability.
Yep, you have that.
Yeah, okay, let's see. Awesome. All right, so good morning everyone. Thank you for the kind introduction. And we'll begin our presentation. So Manila to LAX to I don't know, and now a surgeon, and really not so straightforward journey. So how it started, I was a clueless high school graduate, and most at that time most students graduate high school when they're 16 or 15 years old in the Philippines, and I really didn't know what to do afterwards. So I entered nursing school like most Filipino kids, mostly to be with a now ex-girlfriend. So not really the best decision making at the time. And I guess it really led me to think about what I really want to do for my career moving forward. And one of my first experiences was at this hospital. I was I think it was a late first year or second year nursing student. Nursing school is a 4-year bachelor's degree in the Philippines. So I went to this community hospital. It's a government hospital, so not really much resources. And I was literally in a surgical ward where there's patients right next to each other, divided by curtains. And I was just learning the basics, just taking vital signs and dressing dressing wounds and things like that. And someone asked me this question. Um, in Tagalog, it's ano ba nagkakos ng appendicitis? So that means what causes appendicitis? And I really didn't have a good answer. I had no idea what caused appendicitis at that time, and it made me more interested and inquisitive about pathology and physiology. And at that time, I still didn't know what I wanted to do. I thought that I wanted to go on and finish nursing school. And as the rotation progressed, I saw the surgical residents and what they did and how the patients turned out to be after operations. And I was fascinated. I became interested, and I thought I wanted to become one of them. So that sparked my desire initially to go into medicine. Now, um, things happen, and my dad was already working in California at the time, and abruptly we had to, and fortunately, I guess we had to go to the United States for family reasons. So that meant um, being in limbo. Had to drop out of nursing school. So me and my brothers also dropped out of school so we could come to the United States. And at that time, and this is kind of kind of a little bit personal, we we had an uncertain immigration status back then. So the first priorities basically are to come here, be with family, and just try to survive and financially support everyone, like typical immigrant family story. So at that time, when we finally had our work permits, we started looking into uh, what we were going to do moving forward. We kind of had a little bit of clarity as far as being able to get work and being able to actually support the family more substantially. So, with that, given our background, since I went to nursing school and so did my younger brother, and my older brother who was in physical therapy school at the time too in the Philippines, naturally we looked into healthcare jobs. So there are these programs in Southern California. I'm not sure how it is in other regions, but they're called ROPs or adult schools. So we enrolled in these free programs, basically took advantage of these opportunities and did um, like healthcare introduction classes, including healthcare transport or helping in radiology departments or helping in medical offices, and that helped us land healthcare jobs. So at that time, when we were able to kind of um, get our feet on the ground and be able to have an okay income enough to help our family here, we started thinking about going back to school. So at that time, I thought that I had really high hopes, and I thought that hey, my my uncle who was living here actually went to Loyola Marymount, um, and I thought that man that seems like a really good school, and I wanted to go to that school. So I applied, but unfortunately, we couldn't afford going to. I couldn't afford going to that school. My family is was in a very tight financial situation, as with most immigrant families. So I just had to let go of that dream. I was devastated, but it wasn't the end of the world. And I had that dream of going to medical school, becoming a physician, but no one else in the family had that background, so it was kind of met with resistance, and understandably so, especially within the Filipino community, where a lot of the well-paying jobs were in healthcare and most especially in nursing. So the natural thing for a well-meaning parent or well-meaning family would be to push their kids to go through these paths, which we have initially pursued. So, with that, we started going to community college. So I went to Cerritos College, and at the time, my family thought that I was taking classes to go to their nursing program, but I didn't tell them that I wasn't doing that. So I was taking biology classes and just trying to explore liberal arts at that point, and tried to do pre-medical classes. So I took classes during the day, worked at night. I was a nursing assistant at the time, and also an X-ray department transporter at a different hospital. And I worked at night and weekends. And very in a similar fashion, my brother did work as well while going to community college. What kind of really pushed or set me through this trajectory was the support I got from Cerritos College. I was part of Project Hope, and I was part of CCM, Chicanos for Community Medicine, and also became a part of ALMAS, a Latino Medical Student Association. Um, most of my friends at that time were also trying to get to medical school. So I kind of I got very lucky in that my peers were on the same trajectory. So a bunch of us applied to UCLA SMDP and got accepted. And I think it's one of the most memorable experiences in my undergrad life. So this is, if you can see my pointer, this was me during SNDP program. We spent basically a summer quarter at UCLA and had a lot of fun, a lot of learning about public health and underserved medicine, and just learning how to study well in college and be able to tackle the MCAT and be able to navigate the pre-med path. And at that time also I started working in an emergency room after quitting my job as a CNA and a transporter. So at that time, I was trying to look for 4-year universities to transfer to, as I was a dead set on this pre-med path. So I really wanted to go to UCLA or UC Berkeley, but at that time reality kicked in. There was that economic recession, and this meant that me and my brothers had to stick around locally and try to help our parents out and our family out. So I stayed very local. I didn't apply to any UC, thinking that I think I should still be able to carve out that path to medical school. So I applied to Cal State Long Beach and transferred there. So at Cal State Long Beach, it's pretty much the same life. I took classes during the week, and thankfully the emergency room technician job I had paid a little better, so I was able to cut down my work hours and just work Fridays, Saturdays, and sometimes Sundays. Um, at that time, I thought that, well, Cal State Long Beach has a really good science program and had a really good health professions advising program, but I knew I was at a disadvantage compared to people like kids applying from UCs. So I had to be hyper focused. And then again, I lucked out with an incredible group of friends who also shared the same mindset and wanted to go to medical school and health professions as well. So we basically shared our academic experience. I still continue doing clinical experience by my work as an ER tech, and me and my friends ran student ran health fairs and did the workshops on campus. And we also formed MAPS at Cal State Long Beach, the Minority Association of Pre-Medical Students, and that was a very rewarding and fun experience. And um, I also dove in more into extracurriculars, as it's an important part of applying to medical school, and also finding your passion. So I started out with research, with mentoring and tutoring. And with research, I had no background in research, so I wasn't entirely sure what type of research I wanted to do. So I explored multiple labs. I initially began with dissecting fruit flies in a molecular and developmental biology lab. Basic science was very tedious. I thought that it wasn't for me, at least at the molecular and cellular level. But I wanted to give it a try. Maybe if it had more of a clinical or healthcare component to it, I might be more interested. So I kind of switched gears and worked at UC Irvine and the VA Medical Center in Long Beach, and did gastrointestinal physiology. It was much more interesting to me, but I thought that the hour-long, tedious Western and Southern blots were all too time-consuming and somewhat boring for me. Luckily, one of our investigators also collaborates with the Department of Surgery at UC Irvine, and that's how I ended up doing a lot of my research in undergrad. So I did clinical research, and I really enjoyed it, and ended up doing presentations and posters in undergrad. Uh, Part of being at Cal State Long Beach, I also enjoyed doing mentoring and tutoring, and this is part of our peer mentor organization. We were having a bonfire at that time, usually to welcome freshmen, and I really enjoyed being able to teach and interact and mentor these kids who were trying to get into STEM pathways. And of course, one of the best things I've done in undergrad was to go to conferences, and LMSA, Latino Medical Student Association, was so very organized and very good with networking and mentoring and providing support. So this is just one of the conferences that me and my friends went to. This is at UC Irvine, and most of my mentors were LMSA from UC Irvine, and I couldn't thank them enough. And it really helped me shape my path to medical school. And if not for them, then I don't think I would have gotten the same guidance that landed me to where I am right now. So this is like the most one of the most important parts of being a pre-med, and probably the biggest hurdle for most undergrads. It's the MCAT. So at that time, I took the Berkeley review. I think they're not. There's no Berkeley review anymore. It's been a long time. This was the cheapest back then, but I thought it was far superior than Kaplan, or I think it was the Princeton review as well. So with the old scoring system, it was a scale from 26 or something, I forgot, to like 45. I scored a little low, and I was devastated. I don't even know how this translates to the scoring system now. I just looked this up and looked for the current equivalent. So I scored a 506. I don't even know what that means nowadays. But I took the MCAT again. So, and it's okay to take the MCAT twice. So at that time, I refocused myself. I took less extracurriculars. I took a break from research, and my faculty and my postdoc knew that, and they're supportive about it. So I took an entire semester so I could focus on my classes and the MCAT. So I did better. I did a little better, I guess. And I thought that, well, if I wanted to go to the Ivy Leagues or the top tier, top 5 medical schools, maybe I should retake it. But at some point, it's diminishing returns, and the MCAT, while it's an important metric, it's not everything. Medical schools, yes, they do look at your scores, they look at your grades, but they look at the entire picture. So don't let the numbers discourage you. So at that point, after I took that MCAT the second time, I decided to apply to medical school, and my family, who still didn't know that I was taking pre-med classes, they finally recognized that what I'm doing was actually legit, and did not resist any further compared to before. And at this time, since I was applying to medical school, I knew it was going to entail a lot of money and special for travel if I got interviews at the time. So I worked overtime, and I used my tax refund. So with that, I started my AMCAS application, and like I was mentioning earlier, I had this really good support system when I applied. So we had our pre-med office at Cal State Long Beach, who were very good and very well versed with the application process. Since there are a lot of students from Cal State Long Beach who and other CSUs who get accepted to good medical schools. And of course, the medical student mentors who are attendings now, and I've actually worked with some of them, and I've met them through LMSA, and the surgeon mentors I've met and connected with at UC Irvine, and also the emergency physicians and radiologists from my prior place of employment. And of course, going the information that I gathered from conferences. And so at that point, I had several interviews, and it was, as an aside, it was an amazing way to explore the country. I was in the East Coast, I was in Midwest and several Western states, and it was just very interesting to see how different the culture of medical school is in different parts of the country. And at that time, I was wrapping up undergrad. And by the way, it took me 5.5 years to finish undergrad, so it's okay to not finish school in 4 years. Um, and that's 5.5 years, not even accounting for my 2 years in nursing school in the Philippines. So it's okay to take time. Everyone has their own path. So at that time, I was done with upperclassmen courses, um, and I was taking random but fulfilling and maybe bewildering classes, um, like humanities and all of that cool stuff that I know I wasn't going to ever study again in my life. And at that point, I was doing GPA padding just for fun. I took basketball, weight uh, weightlifting, running, Chinese sword fighting, and karate, and I worked a lot. And of course, I graduated. Let's see. All right. So as I was wrapping up undergrad, I had fortunately had multiple acceptances, and I've narrowed it down to a couple schools. And basically, the choice came down to what is important for me, what are my own values. So at that time, I considered proximity to family. So I knew that I'd like to be, while I don't necessarily want to be in the same home or in the same city uh, i- as my own family, just like in undergrad, I wanted to still be uh, in a place where it's easily accessible to get back to visit family and just be there for them and have their support. Also, finances was a big thing. Um, Student loans are no joke, but don't let that scare you. You'll be able to pay it off. Trust me. And also, like what these specific medical schools have to offer. So, for instance, like some schools have different. They focus on something unique. As an example, UC Davis seeks to. They're a little bit more primary care focused, is what I'm saying, and say Harvard or Yale, they're kind of like more research oriented too. So you'll see that there's differences in their I guess paths that they try to get their students to take. Um, so like I said, I narrowed it down to two schools, and it's probably the most pleasant yet stressful experience to have. But it's a good problem to have. Fortunately, I was in that situation, and I got accepted to my dream school by surprise. I was on the wait list, and I was working a night shift in the ED as an ER tech. And I got an email. Actually, I got a call and then an email from them, but I was working, so I didn't see it. You see that? And then I just randomly checked my email at night and saw that I was accepted to my dream school, and I had to take an extra lunch break to to kind of gather myself since I was so ecstatic. Um, so with that, um, I moved to San Francisco, and this is the UCSF campus. It's very beautiful. This is the main campus at Parnassus Heights. As you can see, this is the medical center. They're actually going to build a new medical center, and then this is where most of my classes were, and this is our neighborhood. So I thought that was the most complex, rewarding, and fun 4 years of my life, and I learned about the world, other people, and different backgrounds. And I didn't realize that I was such a naive guy. Um, all I in Southern California and in the Philippines, all I wanted to do was play basketball. I don't know, drink boba, eat, hang out with friends. But I didn't know that people my age were doing wine tasting for fun or coding and other things like that. And it really blew me away because it was just being exposed to different people of different backgrounds, and it was amazing and again bewildering. Um, so with medical school usually is 4 years, and in general, since there are different schools with different curriculums, in general, the first 2 years are your preclinical years, and the last 2 years are your clinical years. So in my preclinical years, so I learned to study differently from undergrad. I learned to do more structured research at that time too, and also I learned how to network and learned how to become a doctor and learned to pick up a couple hobbies and stuck with them because you really won't have that much time compared to undergrad. So what they say is like pick a couple and just be good at it, and if it makes you feel better or if it relieves stress, then just stick to those things. So for me, it was a basketball and just hanging out with friends, and I just stuck to that. And of course, with that, I made lifelong friends. So this guy eventually became the best man at my wedding, and he is a rheumatologist. And yeah, this is all medical school. We played basketball a lot. I actually played in two basketball leagues, um, and we just had a lot of fun. And San Francisco is a really fun city, and the way I explored San Francisco was by coffee shops. So if I need to study, well, I need to study all the time. So I would just go to a different coffee shop at a different neighborhood and explore that neighborhood after studying. So you kill two birds with one stone. And this is what most of us are doing before exams. And then you go into your final 2 years of medical school. But with that, the third year is usually your clerkship year. And this is when you rotate through specialties. Um, so my first rotation was surgery at San Francisco General Hospital. So we wore green scrubs. This is one of my chief residents who is a trauma surgeon at UC Davis now.
He's one of my really good friends, Ian.
Oh, Ian, yeah, Ian is my hero, man. Yeah, man, like even through fellowship interviews, he's an amazing dude, and I still keep in touch with him. And yeah, I just text him randomly for advice. So you make these lifelong connections. So that was surgery at San Francisco General. I worked with the legendary Andre Campbell, who is an incredibly good trauma surgeon. He's the president of the Society of Black Academic Surgeons, and he gave me a really good recommendation letter for residency, and he's one of my heroes. He's based at San Francisco General, and I think that if I had a loved one who needed an operation in an accident, it would be that guy. Like you would want that guy to operate on you. So that surgery, it was very fulfilling. It was my first exposure. We had a lot of trauma, but not as intense as Harbor or a Highland Hospital. But it opened my eyes to how awesome trauma surgery could be and critical care. At that time, there was a plane crash in 2014, and it was the most chaotic scene in the hospital, but it was also the most collaborative group of people I've seen, and it was such very inspiring to see everyone coming together and work. So I did that, and I did OBGYN at UCSF Mount Zion. And interestingly, that's where I met the love of my life in the operating room at this hospital. And then after that, I pursued a integrated track at UCSF Fresno, because you can do the traditional track, or there's like certain tracks at UCSF where they could combine a longitudinal experience for primary care, and this is one of those programs. So I did family medicine, internal medicine, neurology, and psychiatry in the Fresno and the surrounding communities. And I thought it was very rewarding because it's a very special underserved population in a good mix. At Fresno, you have your urban community, and Fresno was very trauma heavy. So although I did primary care rotations, we had the opportunity to do some rotations or shifts in the ED, and I really liked my time there. And I think with the primary care track, what I really enjoyed the most of these was my family medicine rotation. Um, there was this attending in it's not by sale. I forgot exactly where it is, but it's outside of Fresno. There was a very small hospital, and this family physician did everything. He did his own C-sections, and he also just took care of anyone from neonates to super old people with their geriatric problems, and it was just an amazing experience just seeing that breadth of care. And then I finished up with pediatrics back in San Francisco. Um, we do rotations at the VA. This picture here, apparently we weren't supposed to smile, so I smiled, and then the guy taking the picture was like, "Hey, don't smile." And then I tried to like change my face, and he just took that picture and didn't give me the chance to retake it. So that has been, I just used that badge for my entire time in medical school. Oh yeah, and you take the USMLEs, step 1 and step 2. So step 1 you take before your clinical years, and step 2 you take after third year usually. And then fourth year. Fourth year was the most fun I've had in medical school, because at that time everyone should be differentiated already. Like you should know by that time what you want to go into. So I decided, based on my experiences here and my prior life experiences, that I really want to go into surgery. So most of your fourth year rotations, you could personalize it and gear it towards what you want to go into. So I did sub internships at Highland Hospital in Oakland, where Jubin works, and I also did a couple of sub-Is in Philadelphia and our home institution in Parnassus. Uh, and after, you could pretty much do anything after you've done your sub-Is, since you're already just applying to residency positions. So with that, I did a competitive global health elective where I wrote my own grant, got funding, and I went to the Philippines. And I spent some time at Philippine Children's Medical Center. So I spent time with the pediatric surgeons and witnessed um, a government hospital there where they could it's very low. It's a very low resource setting, but everyone is just adapted to it and could make do with almost just about anything, and it was incredible to see that. And of course, the it was a national pediatric hospital, so you see everyone from across the archipelago. So the Philippines is is an archipelago. It has like 7,000 islands, and this is the biggest hospital where everyone from those islands go to that to get tertiary or quaternary care, and it was very remarkable. So, like I said, it was a design your own adventure. I took an elective in occupational medicine, and I did internal medicine hospitalist rotation so I could prepare myself for intern year and radiology as well. And then you go through the match, and that's where you apply to residency programs. You get interviews, and then you kind of assign your life away to a computer algorithm that determines where you're going to end up for residency. So I ended up at the University at Buffalo for surgical residency. I was ecstatic. I knew I was going to be a surgeon, and there I went. And at the end of fourth year, after matching, I got engaged. I graduated from medical school, and this is me with the Filipino flag stole, like most people would do, representing their heritage. And this is my brother, who is a vascular surgery fellow now. So he took a similar path. After he graduated a couple of years after, and also went through surgical residency in Massachusetts. And he's in Manhattan for his vascular surgery fellowship. Yeah, so surgical residency in Buffalo, lots of snow, but it wasn't always like this. Trust me. Um, you get used to it. I actually love the Four Seasons, and this is just a temporary inconvenience. But snow is beautiful around November, December. Also, since it's really close to the border, What I did for fun was go to Toronto with my friends, and this was the Buffalo um, Niagara Medical Campus. It's a big campus with the Children's Hospital, and this is the Quaternary Referral Center, and this is the Cancer Center. And at that time, so I pursued a 7-year residency where I had 2 years in between for research years. So it was a very busy place. It was the only surgical residency in the area. So we pretty much took care of everything, um, and everyone, including people from south of Ontario, Canada, and Erie, Pennsylvania, and of course the rest of Western New York and parts of upstate. And I got married during my intern year. So during my surgical residency, like I said, I did research years, and as part of that, I studied transplant outcomes and went to grad school at the same time. Um, it was very rewarding, and I thought I was gonna do transplant surgery. So most of my research was focused on transplantation outcomes and organ donation, and I've had the opportunity to present our work in Spain at the International Congress of the Transplantation Society. So yeah, I was representing the USA, and it was a very rewarding experience being able to network internationally and meet and talk to experts in the field and just seeing them in person, and it was such a remarkable experience. And more importantly, during my research years, that's when I had my firstborn. Uh, that's my boy. And senior and chief years, beginning third through the last year of residency, it was a very fun experience because that's when you actually begin to feel like a real surgeon. And so, unfortunately, surgeons work long hours. Surgical residents work really long hours, so you just spend some holidays in the hospital. So this is me and my team and the co-chief during Thanksgiving. And this is
One
during
thing in the hospital during the holidays, you do eat well.
you do eat well, yeah.
There's
And
a lot of good food and a lot of like variety.
there is no shortage. And Jubin, for this guy, they're kind of loaded, and his mom just like cooked an entire Thanksgiving feast for for our team at that hospital. So there was no shortage of food, and that's completely true. Um, so oh yeah, so I was
Yeah, I love the holidays at the hospital because
you get what.
everywhere you go, there's food.
Yeah.
You
Yeah, they'll stuff you, and you'll be in a food coma. It's yeah, that's the hospital, so that's an advantage. Let's see. So yeah, I was applying for fellowships too, and this was it's pandemic era, so I had my suit, and then I I had my I had my PJs and my Crocs, and I was doing my interviews at home, Zoom. Uh, oh, and when I started my chief year, I took this picture, and then I just put it side by side when I started medical school, and it's remarkable how stupid appearing like some things don't change. Uh, Anyways, through the match cycle, fortunately, I matched at my dream program, Harbor-UCLA. And then this is me operating with one of our funniest attendings and my best friend, and this is me in the emergency room intern, and he wanted to look like Ninja Turtle, so we're just playing around, and this is our chief class. And one of the perks at being in Buffalo is you get to work with the world-renowned Steven Schweizberg, who is a big name in minimally invasive surgery, and that's him. And this is the rest of my chief class. And I was wearing the barong, which is a Filipino traditional formal attire. And then the most important thing that happened to me in my senior years was my daughter was born, and that's me and Tony. And how it's going? So currently, yeah, I'm at Harbor-UCLA. I'm a surgical critical care slash trauma fellow. We spend a lot of time, most of our time at Harbor-UCLA, these two places, and then we spend some time at the main campus, especially for liver ICU rotations. So it's yeah, I'm back at Reagan UCLA, and it's very nostalgic. And last time I was there was at SMDP 2007, and now I'm back, and it's just an amazing experience. I recall in 2007 I was across the street when this hospital was new, and I thought that to myself that one day I'm gonna come back, and there it is. And that's pretty much it. And these are a collection of quotes I've gathered, and this is kind of like the theme of my journey. So nobody wants to show you the hours and hours of becoming. They'd rather show the highlight of what they've become. And as you've seen, it's a lot of work, a lot of persistence. And no matter what your ability is, effort is what ignites that ability and turns it into accomplishment. Better is possible. It does not take genius, it takes diligence, it takes moral clarity, it takes ingenuity, and above all, it takes a willingness to try. And there's a fine line between persistence and obstinance. Persistence is refusing to give up on a difficult goal, and obstinance is refusing to consider a different path. Grit is not about banging your head against a brick wall, it's about looking for a way around the wall. And grit is about working on something you care about so much that you're willing to stay loyal to it. Thank you.
Yeah, yes. Last night we had the dean of admission from Stanford giving a talk, and although you always let Atul go on to give a better quote, and somebody asked about leadership, and I just kind of is very close to Atul Gawande, although he says a lot better than I said. It's just doing it and showing up.
Yes. Yeah. Absolutely.
But and the cool thing is you get to go back to Ronald Reagan as an instructor of surgery and not as a student.
It's a quite interesting and fascinating experience.
So you guys have any questions, type away. I mean, instead of asking your friends about being a surgeon, probably should ask a surgeon.
What is the between?
Difference between trauma surgery and general surgery.
Oh, so trauma surgery is a subspecialty of general surgery. So general surgery is, you operate on almost every and any part of the body. Trauma surgery is when you deal with injury and critical illness. So trauma surgery is closely intertwined with the critical care. So if you become a trauma surgeon, you're also an intensivist. So nowadays you go through these 1 or 2 year fellowships. I'm doing a 1 year fellowship. You do trauma and acute care surgery, which is emergency general surgery, and intensive care. So it's a subspecialty of general surgery. So you could be a general surgeon and a trauma surgeon at the same time too.
Okay, the next question is, what if you're not confident with your hands but want to be a trauma surgeon? How do you overcome your fear and objectively sharpen your skills?
You go through residency. So not everyone has. No one's born with. No one is born a surgeon, and I to this day I still have shakes. There are ways to mitigate that, and I not to give a cliche quote, but they don't match you, or they don't take you for for this. They take you for this, because believe it or not, surgery is a cerebral specialty, and it's like being an internal medicine doctor who's really good with medicine, who just happens to know how to operate. That's how I see it. So that could be mitigated. There are a lot of things that you train to be a surgeon. That's something that that could be taught.
While we wait, please put your Q&A or your questions in the Q&A. But how did the pandemic impact your kind of career trajectory and in the last few years?
That's a really good question. So the pandemic in surgery, it has made some, at least in my institution at that time, it made a lot of impact on work schedules and number of cases and what you could do as far as operations. Fortunately, I mean, emergencies and trauma are still constant, so you still get a lot of trauma, you still get a lot of emergency general surgery. The issue then was um, staffing, because everyone's burnt out and tired, and for a time within the ACGME work rules, we were doing stretches of like what, like 2, 7, 14, like 12 days in a row, and then you get like a week off. But we did that only for a couple months as the residency um, coped with the needs of the during the pandemic. Um, the other thing was everyone had to kind of review and revisit ventilation management, mechanical ventilation management, and basic like medicine critical care. Because we were, unfortunately, it didn't happen for a medical center, but if we had another surge that overwhelmed the hospital, then they would pull from other specialties like even ortho or general surgery to manage COVID patients. It was scary, and um, operating with an N95 for a long time is not very comfortable. I'll tell you that. Um, but so it was rewarding. It was very scary though. Everyone was tired. We got through it. Thankfully, um, no one in my residency got very sick. But we were just one of the few fortunate ones, and it was a time when everyone in the program also got together in support of other people. So when people are sick, but thankfully not terribly sick, people stepped up and covered shifts. Um, what is my first surgery? How did I feel? What was my first surgery? It was it was I think it was a lipoma removal. It's so a lipoma is a benign tumor. It's basically just fat cells, adipose cells. So it could be found anywhere, and they could be big, they could be bothersome. If it's not bothersome, we just leave it alone, unless it's it's getting bigger. But it was a minor surgery, so the guy was awake. We put local anesthetic. There were drapes still, so that guy didn't know I was the one doing the operation, and my attending was quiet and just pointing stuff to me, like what to do. He would point to the scalpel and then point to that, like make a cut here, dissect. So it was it was nerve wracking. I mean, now yeah, it's yes, it's a simple surgery, but um, yeah, it was my first time. But thankfully, so in medical school, you do have you learn basic surgical skills, so you could you'll know how to tie knots, suture, and that you try to perfect through your residency. That was fun. And, yeah, you'll be nervous for some and confident for some, depending really on your skill level.
And I think if you're not nervous, then you don't. It means that you don't care. You don't.
Let's see. What's this?
If you're not nervous and worried and
Yeah,
doubt and
yeah,
all that stuff, I probably would not want you to operate on me.
yeah. And, even to this, yeah, to this day, there are, yeah, you have to be somewhat nervous, and what you're saying is completely true. You have to be. There are some operations where you feel completely confident, and within that operation, there will be parts where it's like, huh, I'm not sure what I'm looking at. I'm gonna need another chief, or I'm gonna need another attending to take a look at this. And that's the culture of surgery. Like you don't good decision making entails getting a more senior person to help you, and that's a sign of good judgment. All right, cool. What is
Yeah, so you can see the next question was, since how you learn depends greatly on the surgical residency program you get into, what if you are not in a supportive and learning collaborative program? And what are your options?
that's a really good highly nuanced question. So first of all, when you're in medical school and when you're applying for residencies, that's the purpose of the interview process. And you don't, as a piece of advice, if you're at that stage in your career, when you pick your residency, you don't pick the residency that has the most prestige or the most badass name, or what have you. You pick the residency program, and it's not just surgery. You pick the residency program that you think is the best fit for you, and you think that will offer you the most support and what fits your needs. So unfortunately, there are instances where it's not a good fit, and there are people who just don't jive with their program. Um, and attrition rates in like meaning people dropping out. They're kind of high in surgical fields in general, and some people would alternatively do research as a way to kind of bridge leaving their program and going to a different program. We're looking for either a different specialty or a different surgical program. Um, and then again, this is a it's very it's a case by case basis, because there will be reasons for why a certain resident does not fit well with the program, or just did not meet their expectations. And I think, yeah, that's a very difficult question to answer more specifically.
Yeah, and it's a two-way thing too. Like if
Yeah.
the programs do a really big job to make sure the residents are happy for a couple of reasons. First, the residents are working and seeing patients and actually generating income. The other part of it too, the ACGME residents every year have an opportunity anonymously tell ACGME how you're being treated, and those are all confidential, and your boss has no way of knowing what you wrote, but also, um, and so they could come down on them pretty hard, and a lot of programs had to adjust to that. But at the end of the day, surgery is a hard specialty. It's not. It is. I mean, it's long hours. You have to get up early. You have to stand for long periods of time. So I think most of the people that I know that have left, it's just because they just couldn't do it. And it wasn't because of anything else. They just did not want to do that. And that's okay. There's other things you could do. Some people are bent on shape of becoming a surgeon, but are not willing to put the effort and the time, and it's just not just in operating them, it's reading, it's preparing, it's practicing, it's going to sim lab, and nobody's forcing you to do any of that stuff. You have to do it yourself to be better. I mean, if you ever get a chance to read Better by Go On Day, that talks about that. So you have to want to do it. And some people are just not willing to do it.
Oh, as an aside, so all the things that Jubin said is completely correct. Um, by the way, yeah, that book, Better. When I was having a rough time in pre-med, I read that book, and it helped me kind of like find myself again, and get through pre-med and go to medical school. But anyways, yeah, in surgery, sometimes it's also the expectation of the person going into surgery. Unfortunately, there are places where if you don't have a good clerkship rotation, where you didn't really get exposed, or you did not understand what it is, what being a surgical resident means, then you'll have unrealistic expectations of, oh, I'm gonna be leaving at 5 p.m. or I have short call and long call. No, that doesn't happen in surgery. You work long hours. Yeah, like it's still within the 80-hour work week these days, but it's still very demanding. It's yes, you have
It
to.
is not Grey's Anatomy.
No, yeah, you have to read a lot. You have to prepare. There will be times when you will, depending where you are in the nation or what program, you will get yelled. You'll get yelled at for a good reason, and it's not, it's not all glorious scenes that you see in TV, and it's life and death a lot of times, and not to hit another cliche, but it's literally saving life and limb. So it's high stress, high stakes, but it's very rewarding. What's this? Oh, what if someone is not comfortable with seeing blood? Uh,
I would say not just blood, but vomit and puke
yeah.
and burnt skin and
That then surgery's probably not the right field if you're not comfortable seeing blood. I mean, one could do radiology where there's no blood. Well, unless you go into interventional radiology. You could do nuclear medicine. There's no blood at all. Um, Maybe internal medicine in some aspects, primary care. But surgery, you're dealing with blood all the time.
and the other thing is I just want to add, and I always tell this to medical students, is it's not normal to look at blood your first time and not get sick or woozy. But just say something and it's something you get used to it. It's not, you know, you don't walk around your life seeing blood all over the place. I think you just get comfortable to it and you become adapt to it. Now, um, Dr. Narvaez worked in the ER for a couple of years before he even went to medical school. So for him, it was probably not much of a transition. But if you in medical school, you do enough rotations to see that, and I think it becomes okay. But if you're the what is that fear of blood? I think it's like some like
Yeah.
2% of population have like some sort of
You,
then
you,
yeah.
you can do like sensitivity training, but that's a good point, Jubin. Actually, if you so as pre-meds, if you're trying to test the waters, yeah, when you volunteer in the hospital or when you work in the hospital, like, go to the ED. Like you'll see a lot of that, and then you'll be able to. I don't want that. And you could do you know if CCE is still a thing? Or the clinical care experience, is that like a thing still?
I know that some of them are still around. I know they stopped for the pandemic,
Uh huh.
but there's a lot of opportunities. We actually had a whole workshop on things you could do to get into a hospital. I'll put the link in there, but there's medical scribing. You
Mm-hmm.
could actually get paid to do that. There is I'll put that link of the workshop that we did. You have 4 or 5 years to actually experience that. So that's why like most schools want you to have shadowing and clinical experience. It's for that reason, to have a real expectation of um,
Yeah, like
of what medicine is.
yeah. What's interesting is so when I took the Berkeley review, one of the founders' name is Todd Bennett, and he also looks through he had some affiliation with the UCI admissions, and he's looked through some essays, and there was one particular essay that stood out. It's about the smell of medicine, and it was such a profound statement, because yeah, what is the smell of medicine? You go to, like, Jubin works at Highland Hospital. You go to that area, you smell, you know, homeless people, you smell alcohol, you smell urine, you smell feces, betadine.
Yeah.
So it's not just the blood.
And I used to also work at UC Davis, and we were a burn center, and
Oh,
and
oh, yeah.
burn burn is still for me the hardest. Is that you
Oh
just
God.
it just stays with you, and you literally. The first time I was actually exposed to a burn patient, I had to put menthol on my nose because I just couldn't get the smell out. And yeah, so it's not just blood; it's smell. It's
Yeah.
you know,
Everything.
um, uh, or even like when you open a bowel, it's not the most enticing smell in the
Poop.
world.
Yeah, it's poop. Yeah, you do these. I one of the I guess most interesting experiences in residency I had was when me and my attending took someone to the operating room for a perforated colon, and this guy had it was a lesion at the very end of the descending colon, so everything has been backed up. You could imagine poop backed up for a long time, and that thinned the bowel and perforated the bowel. So literally, me and him were taking turns scooping up poop into buckets in the operating room, and it was in the middle of the night, and we were just laughing to ourselves, and we basically alternate because we would get tired. I'm like, hey, Dr. Adams, like I need a break, and then I go to the other side, and he like keeps on scooping scooping poop. So that's a smell of medicine.
Okay, the next question is,
I'm always oh sorry. I'm always
go
amazed how the human body smells, and it's
Yeah, so all
uh,
right, what's this?
but the next question on a slightly different topic is, what if you make mistakes in surgery? How is that rectified, and how are you protected from malpractice and other, repercussions?
Yeah, so good question. So in surgery, say when you're in residency, so you have malpractice insurance. Um, as far as surgical mistakes, so it's not a black or white thing. These are varying degrees of mistakes, if you will. There is a process in that's I think it's in every field, but it's just more pronounced in surgery. It's called M&M, morbidity and mortality. It's a closed door conference. It talks about like no recording of any sort, at least in our institution, and it's basically the goal is to identify mistakes and what everyone could learn from that. In some cultures, it could be a highly educational, supportive experience. In some cultures, it's it's kind of a crucifixion at times. So so rectifying by identifying what the mistakes and knowing what we could have done differently. So again, read Better by Atul Gawande, and also read Complications by Atul Gawande, and you'll learn a lot more nuance about it. And how are you protected? There, there's always an attending surgeon above you as a resident. So it's the responsibility of the attending to, at least in New York State, they have to be there for the majority of the operations. And they're there to double check you, and it depends on your level of autonomy. So as a chief resident, you're pretty much doing your own cases. The attending is there for the critical parts of the cases. So a lot of it also is practice and clinical judgment. So for instance, you say you clip something wrong and you're like, oh, I don't think this is the right thing to do. Then you get your attending, or the attending's there, they could stop you in your tracks. Or if you've like committed that mistake, they could a lot of times, fortunately, a lot of times they could bail you out. Or if you're taking a junior through an operation, you could bail that person out. But there are also devastating mistakes that are unavoidable just by the nature of the disease and how difficult the operation is. And if and when that happens, and fortunately, it's very, very rare. There's a risk mitigation, there's risk management, like legal departments in the hospital. But those are very, very, very rare instances, and a lot of times it's such a nuanced question. Um, it's there are patients that have simple anatomy, and there are patients that have very difficult anatomy, and it really just depends on the operation. What's this?
Yeah, and I think I would just add this is that they know what you know and what you don't know, and they have a vested interest for you to be successful, but also the attending their names on the chart. So they're not going to let you do anything that they don't feel comfortable that you could do it, and they're there to help you and teach you. And a lot of them went into academic medicine for that reason, to teach you. So they're not there. Nobody's forcing them to be there. They could actually make a lot more money working in private practice,
Yep.
but they chose to be there because they like the camaraderie and teaching um and so yeah, it's not like the movies where, I have a couple of friends that watch Grey's Anatomy, and I watched like a couple of series episodes of it, and apparently this intern was doing a craniotomy, and I'm like, yeah, I've never seen that happen. So
No intern does a craniotomy.
yeah, but
Oh my God,
so if any of you are watching like those shows, like
it's not real,
it's
man.
not real.
There is a I forgot what show was that, but it was a commercial for that show, and then someone was saying that they hit the appendiceal artery, and then like the guy coded, and then the patient died. You know, when the when you're supposed to actually cut the appendiceal artery when you're taking the appendix out, so you just ligate the vessel. You're supposed to take it out. Yeah. So it doesn't. Patients don't go into extremis from a from a that operation, and they don't exsanguinate that dramatically. No, a lot of times. So you got something bleeding in front of you. Yeah, put pressure on it and find where it's bleeding from. And control the bleeding. Yeah. So this is why I hate watching. Like my wife loves Grey's Anatomy and those shows. I could not stand watching medical shows. I don't know if she does it. She's an OBGYN, but I have. Oh my God, I just could not watch medical shows. What's
Okay,
this?
someone else asked, if you are past the resident stage, who do you go to for help?
So once you're an attending, so I'm past the resident stage, so I'm a fellow, so I go to the attendings. When I finish fellowship and I become a full-fledged subspecialty trained boarded attending whatever, I have senior partners or or your peers of attendings, and in an academic department it would be like your division chief or your chair or someone who's just more senior than you. So if you encounter a problem or if you're not sure what you're looking at, so you try to call them, and you form these partnerships and relationships with the mentors too. So a lot of them, most of them, are open to being called, and that's what they're supposed to do, and that's an expectation. There's a junior attending, and you're the senior attending, and they're there for you as a backup.
Okay. And so keep putting your questions in the Q&A, but another question is, you mentioned like throughout your kind of career progression in the US, kind of keeping in touch with your culture and, your heritage. Why was that important to you?
Um, it's a part of me, and I I mean I'm Filipino, Filipino American, no matter what happens, and I think that especially in the community where I'm at, and this is partly why I ranked Harbor-UCLA very high for fellowship. I'd like to be in that community where I see people, not just necessarily Filipinos, but like I see that diversity. I see that community that look like me, and I know that they look to someone who looks like them for care, and there's a lot of data to support that, and being even on a micro like day-to-day level, being Filipino, being able to relate to people who speak the same language and appear similarly to you. For instance, daily work, it makes work easier and more fun. um, sometimes when I need something to get done, like really, really, if someone's like, I think someone's gonna tank and not do very well, and I need a certain lab test done. Sometimes, sometimes nurses take their time. If I need something done like right away, I talk to them in Tagalog and be like, "Hey man, I really need this done." Like, oh yeah, sure. There's some perks to it too. So yeah, it's an inseparable part of me, and it's more of being able to relate to people um, who look like you and underserved communities too.
And how did it impact, like, or what was it like having kids while you were in residency and like in fellowship?
Mhm.
And how did that impact like your work-life balance as a surgeon?
So initially, so it's kind of a unique, difficult circumstance. Let's just say so. When my family was with me during residency, you're you're very tired. It's very difficult. Fortunately, my wife was very supportive and took you basically took care of everything, which I owe her a lot for doing that. So it's a matter of support. The issue was we're in Buffalo too, and we're not near any family. And oh yeah, and that's one thing. When you pick a residency program, think of being a program where you think you'll have family support, especially if you're thinking of having a family, because that really eats up a lot of time and effort. Um, Although it also makes it also made residency, while it was very difficult, it made it bearable too. Like imagine going home at the end of the day and then your kid just runs to you, and it's such an amazing thing. And on my days off, we just do a lot of things for fun, and it just balances everything out. So priorities change. You have to carve out time for them. You have to, especially in this day and age. I mean, gone are the days where surgical programs brag about their divorce rates and things like that. No way, that's not the culture anymore. So you just gotta make time for it.
And if you, looking back on all the steps that you took to get to this fellowship, if you had to, or like if you had the opportunity to change something, would there be something specific that you would have done differently?
Uh, I just wish I had more money and resources, if that's even possible. But other than that, I think while it was a convoluted path, in general, I mean, of course, like everyone will have regrets. Oh, I wish I would have done this. I wish I would have gone to that school and whatnot. At the end of the day, you've put in all the work. You've done whatever you can, and eventually got you to that path. And I don't think I'd change. I don't think I'd change anything in general. Well, if I had a lot of money, then it would have been easier. But no.
Do you have any specific advice for people who are trying to manage the financial aspect of putting themselves through,
Mhm.
undergrad, medical school, residency?
Yeah, yeah. That's unfortunately, not everyone are trust fund kids. I'm definitely not. A lot of people who are tuned into this program, I would safely assume that we are not. Um, I think that, well, for one, there's the reality of student loans. So in undergrad, when you are taking student loans, live within your means. I mean, yeah, I don't know what you kids nowadays like. I don't know, iPhone 14s and Yeezys. I don't even know if that's the thing right now, or like weird looking clogs. If you really don't need it, just don't buy it. I don't know, invested in I found this like website who was gave gave a really profound advice. Like this lawyer was saying, instead of buying the new iPhone 14, why don't you invest that money into Apple stock and make like 3 or 4 times more? I was blown away by that. So live within your means. As far as student loans, when you get that student loan package, take only whatever you need. Although I understand that you also need to allocate for your wellness. I mean, you don't have to live extravagantly, but you do need to spend that money for, I don't know, you'd like to eat a nice meal once a week. And yeah, you need to reward yourself. You need to have fun, but you don't need to be extravagant about it. And if you can, so in undergrad, I'd say, um, so just be efficient with things. So for instance, if you need money, why don't you get you need money and you need healthcare experience. So why not just get a healthcare job? So you get that healthcare experience, and it's much better than volunteering. Because what do you do when you volunteer? You give ice chips and towels and things like that. But when you're a medical scribe, you're you know what histories and physicals are like. Or I guess now it's not this anymore. So you know what history and physicals are like. You know what it's like to be in the emergency room. You know what it's like to um, position patients, and you have that interaction with the patients too. And you're making money, and you actually make good money doing that. So you'll have that extra funds for your purposes. Uh, and oh yeah, looking back, um, community college is a really good deal because you can still transfer to Berkeley, San Diego, or LA, and essentially cut the expense in half because it's not as expensive as UC or Cal State tuition. Even Cal State tuitions have spiked. So making those choices, so it's not like, oh man, like it's this is not as as legit because I didn't go to UCLA for 4 years. I mean, at the end of the day, you graduate at UCLA with the same diploma as someone who transferred. So there are opportunities to make sensible financial decisions. Not that I'm you know I'm an expert in finances, but I think there are small opportunities where you could capitalize on saving and making money. But you will be in debt, and it's okay. You will pay it off. And say if you're gung ho about primary care, there are loan repayment programs for primary care. In fact, there are plenty, and it serves our it serves your purpose too, to serve the underserved communities, and you get paid nicely, and you get your loans repaid. So there are options out there.
Yeah, so there's Cal Healthcare that if you go in an underserved area, they will pay up to $300,000 worth of your um
Yeah, and just because you're in an underserved area doesn't mean you're in the middle of nowhere. That's like it could be in an underserved like urban area too, as
Santa
long
Ana is
as that's
considered
immigrant. What's that?
Santa Ana is considered
Yeah,
underserved.
yeah. Like
Heart of Orange County.
it's as long as it's designated by HRSA health. I forgot what it stood for.
F,
Something.
yeah, HRSA, yeah.
Yeah, as long as it's designated by HRSA as a medically underserved community, you're good to go.
Um, Once you finish your fellowship, what do you kind of see yourself, or yeah, over the next few years, what are kind of your goals or what your plan is?
So my well, I guess personally, I'd like to take care of my family first, and then pay off my debt, and then professionally, I'd like to be more active in clinical surgery. So kind of like private practice, but I'd like to be in a private slash academic setting, and there are places like that too. So I'd like to eventually um, bump up my research career too. So in short, I'd like to be in an academia or what's called a private temia, like a hybrid setting. But I'd like to be in a setting where I could teach residents, do research, and of course operate the lab.
Looking back at your experience in kind of more of the nursing side, like in nursing school and as a CNA and stuff like that. How did that help or influence your path then once you were like more strictly pre-med?
I think it you you just become more in tune and empathetic to patients, um, and it helped me as far as its impact on me being pre-med. There was a benefit. I had clinical experience. I had access to clinical experience, and it kind of put things into perspective as well as a pre-med, because and it ties in with the clinical experience too, and being more empathetic to patients. Um, for instance, you know what patients are going through on a personal level because you get to spend a lot of time talking to them. Like I remember working in a nursing home, and you hear their stories, and even even working with nurses too. You know how they think, and how they interact with patients, and you know what their needs are. So it adds a different perspective to you as a physician. So you know what their needs are. You know what they're thinking. So you're able to communicate more effectively to them. Uh, yeah, it has a lot of advantages. Um, one of the most practical advantages it offered me was, I made money. I was able to help out my family. I did kind of deprive myself of what most 20 like teenagers and young 20-year-olds would do, like partying and stuff. I remember on my 21st birthday, I was wiping butts at night. And this CNA that I was working with, she was this Guatemalan lady, and she was like, "Oh, lo siento, papi." And we were tag teaming, changing diapers in the middle of the night, and I thought, you know what, it's okay. I may not be partying today, but yeah, I'll get there. I'll get to my goal, and I'll be able to party in medical school. Yeah, and I did. Yeah, I did party in medical school.
Can you speak a little bit more to how going to UCSF Medical School gave you like you talked about the different locations of your like when your specialty rotations and how like that helped going to UCSF getting to access those different
Yeah.
kind of places.
Yeah, so most medical schools will offer you a breadth of experiences. So it's like it's not just unique to UCSF. What is unique to UCSF, I will say, is you're in San Francisco, you're in the Bay Area, which is a very fun, diverse, vibrant area. So as far as the rotations, the hospitals are also different in terms of patient populations, like with a lot of places too. But you had San Francisco General, which is like Harbor-UCLA or Highland Hospital in Oakland, and it's it's the diverse underserved urban underserved community. And then you go to UCSF Mount Zion or Parnassus, or now it's UCSF Mission Bay, where it's the world class quaternary referral center. So you get the most complex cases and even like the most affluent people and patients, which is a little different patient population, different experience, different flavor. And then you have Fresno, where you have a lot of rural communities. Fresno is still an urban area, and they have a really good trauma center, which is probably busier or just as busy, I think, as Harbor and USC. And you do get a good mix of exposure to a variety of diseases as well. So that's UCSF. I'm gonna contrast that with well, not really contrast, but similarly in Buffalo in New York, yeah, we had a suburban hospital where it's like suburban community, affluent, whatever, and then you have Buffalo General where everyone from southern Canada and Erie, Pennsylvania, and Western New York, and like you get the sickest patients, and then you have the county hospital too, which is very similar to Highland and Harbor. where some gunshot wounds and things like that, and people who don't show up until they're really really sick. Well, you will get that breadth of experiences. It's just what locale or what region you're gonna be in, and it'll have its own flavor, so to speak. Hmm.
Yeah, so the question and in the Q&A is, as a pre-med, what are some techniques we can practice to enhance our surgical skills for the future?
I'd say study really well.
Yep. Be a good test taker.
I would study really well. Like as a pre-med, um, know how to study, know how to read, know how to understand concepts, know how to understand genetics, biology, physics, learn how to do well on your exams, and learn, and not just like being a good test taker, but be a really good critical thinker. And that's the best preparation for surgical skills that you'll have. Because again, surgery is a very cerebral specialty. It's not just this, but it's more this. Well, you could teach a monkey to do whatever, not tying, whatever, and that you will learn in medical school. So I wouldn't even worry about it. No, I wouldn't.
Actually, technically, you don't run.
Yep, I will not worry about that right now. You worry about this, because once you get to medical school, you will have seminars, and and things like that. You will learn the technical skills in medical school and surgical residency. What your job is as a pre-med is to take care of this, because you need to think, because no one wants a technician for as your surgeon. You want a physician and surgeon, not necessarily a technician. So you take care of this, and then this will come later. Don't worry about that.
Yeah, you don't need to practice suturing on your friend. Technically, you go to jail for that. But yeah, none of that stuff, even not tying and stuff, that they don't really teach it until your residency.
Yeah, you
You don't need any of that stuff. You need to be a good test taker, study, learn concepts, materials. Yeah, they don't even do they even teach you knot tying in medical school?
Yeah,
Unless you do like a rotation through general
you
surgery.
do. So at UCSF there's a surgery interest group. So first and second years they kind of
Yeah.
start off with like basic knot tying, suturing skills. But then again, um, those are workshops that's like once a quarter or something, and then you shadow. But the
Yeah.
real bulk of it you learn in your surgical rotation, your clerkships, and that's what the residents' jobs are. They're supposed to teach you how to tie knots, how to suture, um, and deal laparoscopic skills, like fundamentally. And then a lot of that also happens in surgical residency. So even as like in your early years as a surgical resident, as a first year, second year, yeah, you do operate a little bit, but it's not your job. Your job is to learn how to manage surgical patients. Again, that's where the cerebral part comes. You need to manage the patients. You need to know what to do if someone's bleeding, if someone is in atrial fibrillation, if someone has a fever, what do you do next? How do you take care of infections, surgical site infections, things like that. And then as a late second year, third year, and then as you progress through your chief years, then that's when you're just like operating and operating. And by chief year, you're at the end of chief year, yeah, you're a you're a real surgeon.
You could do you could one-handed ties. Yeah, I
Oh,
think that I think the challenge is that some pre-med people that try to target pre-meds have like suture labs and stuff, which it's fun to go to and everything, but I would say instead of learning how to do continuous sutures, spend that time, understanding concepts of physiology or
yeah,
yeah,
that's very true.
okay.
Looking back, and everyone hated physics. I hated physics, but my God, that is like the most applicable of all the pre-med courses. Well, of course, social sciences and what have you, but physics is a real, like you apply it daily, even in God, like even the bowel,
Injuries.
even
Yeah.
the colon. Like you're talking about when I teach residents, like oh yeah, the cecum is the thinnest part of the colon. It's gonna tend to perforate more because of law of Laplace. little did I know I'd be using that. And everyone talks about that. And then, like, oh, the size of IVs or central lines that you put in trauma patients. Like, oh, you should put a cordis in because it has, like, the shortest length, biggest diameter, blah, blah, blah. That's physics, right? Flow dynamics. So, physics is very applicable. And you're thinking about, oh, I don't, well, of course you don't use calculus every day, but in critical care you think about when you explain pulse pressure variations when you're trying to give IV fluids to septic or bleeding patients, like, that's actually, pulse pressure variation is actually the area under the curve of these waves that you see on the monitors. That's what accounts for it. Fascinating, huh? So again, don't, yeah, like suture labs, it's good as like a,
Motivator.
yeah, motivator, yeah, like going to a gas station, getting your fill of medicine, gasoline, or what have you.
Sweet too.
The real thing, the real deal, I'm telling you, for pre-med is think, learn how to think. Because guess what, you want to go into trauma surgery, or let's just say you're a chief resident, you get woken up at 3:45, no, not even that, you get woken up like 2:10 a.m., and then, like, you're dealing with someone who's very, very sick. You gotta be able to think. Yeah, this is like it will become second nature, but this, you have to develop that.
This is a good question. Do you use a lot of math?
A lot,
Well,
the math. I use a calculator. I use I use a math. I kid you not. I use a. So I mean, yeah, you kind of do percentages, things like that, but they're medical calculators that you need because there are a lot of nuanced formulas.
so I would just say this: you don't use math. You don't have to sit there and do proofs on the board for 3 hours. You need to understand concepts like area of a curve and be able to put it in a calculator and kind of understand the concept that it's a continuous line, or putting in central lines or Swan and gas, the understanding where those arterial pressure. So you got to understand these things. You don't need to know them, but the only way you could understand them is by doing them now. Nobody's going to sit down and teach you integration in medical school. So you do that in undergrad. And if somebody's explaining and you have an idea, okay, yes, I took a year of calculus and I understand integration and a curve and, you know, and understanding, or even doing like differentiation and those things, you have to understand them and you have to know them. Nobody's going to make you go up there and do proofs. I would say if you even take some of the attendings to do proofs, they will all fail, but they understand concepts. And the only way you understand a concept is you do it enough that it becomes a second nature, but you don't fully,
The math part too. So in residency, and if you go into academia, there's a lot of research. So a lot of it too is knowing statistics, what type of tests are are done for what type of population variables. So, oh yeah, so learn statistics. Pay attention to statistics. Yeah, because you know what? When you apply something to your patient at the bedside, you will be looking through the literature. You'll be looking through scientific papers, and then it's up to you to critique that and see how that applies to your daily patient care.
All right. Well, it's actually past 12:30. So I don't, if anybody else has any other questions, we're gonna let our speaker
Ooh,
go.
sorry, I got one more thing. Okay, if there was one thing I'd change, I would take a finance class actually, or like economics class. If you guys could do that in undergrad, yeah, I totally do that because I'm a late bloomer in like finance and economics. I would have taken that class.
Did you ever read White Coat
Yeah,
Investor?
yeah, yeah.